Hi everyone, good morning.
Good morning, sir.
Okay. Yes. What is your doubt? Oh, okay, we will see about that meningitis. So before that, you know what do you mean by meninges? What do you mean by meninges? It is the covering area that covers the brain. Okay. If there is any inflammation in that meninges, that one is known as meningitis. So it is a serious and potentially life-threatening infection that inflames the meninges, the protective membrane surrounding the brain and spinal cord. So as we already mentioned about that it will cover the brain and spinal cord if there is any inflammation. So usually the term that ends with the itis means there is a inflammation. Okay, so here there is a inflammation in this meninges, so that will lead to meningitis. What are the different types of this meningitis? Bacterial meningitis, viral meningitis, fungal meningitis, and parasitic meningitis. There are four types we have written, that is bacterial, viral, fungal, as well as parasitic meningitis. What are the causes for this meningitis? Mainly, if there is any infection. Okay, so if there is any infection that will spread to that meninges, it will cause the meningitis. Okay, then age, mainly infants, young children, and elder people. Okay, that is older adult will be affected with this meningitis. Infants, young children, and elder people will be affected. They are at the risk of getting affected with this meningitis. Then weakened immune system. If there is any usually, children will not be developed with the proper immune system if they are not feed properly. Okay, so if there is any weakened immune system, that will lead to meningitis. So people with weakened immune system, such as those with the HIV/AIDS, if they are affected with the HIV infection, are taking immunosuppressive medications, they are at the risk of getting affected with this meningitis. Then head trauma. If there is any injury to your head, okay, that will also increase the risk. What are the symptoms of this meningitis? Normally, fever, headache, then stiff neck, okay, then confusion, vomiting, finally seizures will be there. Fever, headache, stiff neck, confusion, vomiting, as well as seizures. Okay, what are the drugs that will be given for this meningitis? That is antibiotics. First, we will prefer with the antibiotics to treat the bacterial meningitis. In case of any fungal infection, then it will be treated with the antifungal agents. Similarly, if there is any viral meningitis, means it will be treated with the antiviral agents. Then, apart from these drugs, supportive care such as fluid replacement, oxygen therapy, and pain management will be there. Then, in order to reduce the inflammation, corticosteroids will be provided to reduce the inflammation as well as swelling. So, what are the complications for this meningitis? First one is brain damage. Then there will be vision loss, then hearing loss, then learning disability. So, brain damage, vision loss, hearing loss, and learning disabilities. One drug we are going to study about, that is an antiviral drug that is used for the treatment of meningitis, that is acyclovir. Okay, so acyclovir, it is an antiviral drug used to treat meningitis caused by the herpes simplex virus. In short, it is known as HS. Okay, so what is this? Have you seen this structure before? Huh? This is the pyrimidine fused with the imidazole. Okay, pyrimidine means 6-member ring in 1/3 position, nitrogen will be present, and this is the imidazole. Okay, Imidazole means 5-member ring. 1/3% nitrogen will be present. Just remember that one. Pyrimidine fused with the imidazole. This in short it is known as U. Okay, how will you number this one? You have to start the numbering here 1, 2, 3, 4, 5, 6, and 7, 8, 9 like this. You have to give numbering for this one. Okay, so this is the structure of acyclovir. Here one nitrogen is present and amino group is present. Then apart from this CH2O, CH2, CH2OH. This is the 9th position. Here hydroxy group is present. Okay, 2-hydroxy ethyl methyloxy, the 2-amino purine 4-bone. This is the structure of acyclovir. So what is the mechanism of action of this acyclovir? So it will be joined with the ATP in presence of the enzyme HSV, that Herpes simplex virus thymidine kinase. It will be converted into acycloguanosine monophosphate. Here ATP we are adding, so it will be converted into monophosphate. Then followed by the treatment with the cellular kinase, it will be converted into, that is monophosphate will be converted into triphosphate. This in presence of HSV DNA polymerase, it will bind with the incorporated into that viral DNA. So what will happen? There will be inhibition of that viral DNA synthesis and viral replication process will be stopped. Okay, so acyclovir that will be added with the ATP. So in presence of enzyme HSP thymidine kinase, it will be converted into acycloguanosine monophosphate. In presence of cellular kinase and addition of that ATP, it will be converted into triphosphate, acycloguanosine triphosphate. This is followed by incorporated into that viral DNA that will inhibit the synthesis as well as replication process. Let us see the synthesis of this acyclovir. First we will start with the cyanobenzene. So cyanobenzene on treatment with the diethanol, it will give the product. So here it will be converted into COO, CH2, CH2, OH will be Cl. That cyano group will be converted into COO, CH2, CH2, OH. Then followed by treatment with the hydrochloric acid and formaldehyde. What will happen? Here OH group will be replaced by that Cl. Chlorine will be replaced. So Cl, CH2O, CH2, CH2O, CO will be added there. This is followed by, we are treating with the dichloropurine. That 2 chlorine atoms are present here. You will find that one. It will be added to that this compound. So purine will be added. So it will be converted like this. Then we are treating with the ammonia and methanol. We are treating with the ammonia and methanol. What will happen? Here this benzene group is removed. Then it will be converted to NCH2O, CH2, CH2OH. Followed by treatment with the sodium nitrite, and it will be converted to, here you will find the change, that NH2, as we already studied about that sodium nitrite, hydrochloric acid. This ammonia will be converted into alcohol. OH group will be added here. So next step is we are treating with the ammonia. What will happen? One hydrogen will take the chlorine, that will be eliminated as hydrogen chloride. So it will be converted into NH2. So our product is formed. You will find the answer that this is the hydroxy group is present. It will be converted into keto group. So also keto group is present in that one. You will find that one. So keto enol tautomerism will be carried out. So our product will be formed. Finally, acyclovir will be formed. This is the synthesis of acyclovir, and this apart from that meningitis, it is also used for the treatment of genital herpes, cold sores, then shingles and chicken pox. These are all the uses of this acyclovir. Dharani, I hope that I have answered your question. Thank you. Thank you.